Well, I hope you guys have some energy and don't totally fall asleep after lunch, because I think that's what 90% of us want to do is after lunch, we just want to take a nap, crawl under the tables, turn off the light. But we'll try and keep you awake and hopefully give you some good news as we go through this presentation and discuss the Family First Prevention Services Act Part 4, Aftercare and Wraparound, so STRTP Aftercare. And just as a quick show of hands, how many of you are familiar with the Family First Prevention Services Act, Aftercare? A few of you. How many of you are familiar with Wraparound?
No, we're not.
Oh, awesome. That's great. Okay. So we'll have a few icebreaker activities. We can't do any like around the room icebreaker activities because we'd be tripping all over each other in the tables. But we all want to get to know a little bit more about how well you guys know Wraparound, your experience with it, been a part of it, and that sort of thing. But first, we'll do introductions. My name is Daniel Wilson. I'm a manager of the Family Centered Practice Unit at the California Department of Social Services. Been at Social Services for about 8 years, and before that, I was a line staff case carrying social worker in Sacramento County, and I've been a resource parent as well. I will just turn it down the line and pass it on to Rachel.
Very good. Good afternoon. My name is Rachel Leitenberg. I'm a division director for our Riverside County Special Services Division, which takes care of all of our youth that are in out-of-home care. Worked for the department for 22 years, and I'm not ashamed to admit that working in juvenile and working with kids in placement is always my favorite place to be. So I'm glad to be here today.
Good afternoon, Jamaica Walker. I'm with San Francisco Juvenile Probation. I am the probation officer in placement and J-Crew, which is our Juvenile Collaborative Reentry Unit, and I also supervise our secure track youth.
I'm Mila Baranoff. I'm a supervising probation officer with San Francisco Juvenile Probation, and I'm the supervisor for placement and reentry units. So our unit has every youth who is not home with parents, be that juvenile hall commitment, RFA with a relative or a non-relative, STRTP, SYTF, anything that's not home with parents. And I've been with the department since 2008, supervising placement units since COVID, which was fun to take over a unit during COVID, placement especially with FFPSA rolling out. It's been a good ride though, so I'm happy to be here today. Thank you.
No shortage of changes at all.
No.
For any of us.
No.
The whole world is changing around us, all the laws, all the regulations. Thank you all for being here. I'm so excited to be here. Thank you to CPOC for having us here, and for Riverside and San Francisco Probation. And you'll hear today, after I kind of go through my piece of it, you'll really hear both what these counties are doing in regards to wraparound and aftercare, and also their barriers. And we really wanted to make sure that we highlighted the barriers piece, because we're all experiencing barriers at the state level, the local level, in the community. And to really not dive into that and talk about barriers that are happening would be inauthentic and a disservice. So we'll definitely have some time for that too, and to the degree that we're able to troubleshoot through some of those barriers today. So I wanted to ask another couple questions. So who has actually been a part of a wraparound team before? Like one of your youth has, and families have received wraparound, and you're a PO, you've gone to the wraparound teams, you've been a wraparound facilitator or some other partner. So several of you, that's awesome, that's great. So we're going to run through some of the resources that can support high fidelity wraparound and specifically aftercare, which is kind of the mandate piece that we'll be talking about today. And wanted to see, can you guys just randomly shout out 1 to 2 words of what you think of when you think of wraparound? Team. Support. You guys can be louder. I know how it is when you're on the line. There's loud, there's curse words flying, so I know you can get loud. So what do you say it again? Collaboration. Resources. Intensive therapy support. Any other thoughts that come to your mind when you think of wraparound? Family support. What about barriers? When you think of wraparound, these are all really great words and things that wraparound strives to do. What are some barriers when you think of wraparound?
Eligibility. Fidelity.
Yep.
They're a lot quicker with the barriers than they were with.
And this is great. This is why we're here today. And we're really trying to leverage this mandate of Aftercare to address these issues that all of you just spoke of, the fidelity, the eligibility issues. We're trying to do what we can at the state level to help with those staffing issues too. So we're going to be talking about some of that today too. So as we look at the agenda, I'll be talking a little bit about the history of wraparound in California, an overview of the Family First Prevention Services Act, and then discussion around leveraging wraparound for FFPSA Part 4 Aftercare. And then I will turn it over to our partners with Riverside County and San Francisco County to talk a little bit more about what does all of this look like and really the planning of this look like at the local level, because we're all just starting out really in thinking about either leveling up our wraparound programs or for some of us completely implementing new wraparound programs. And so as we get started, we're going to watch a quick video around and hear what the experts, hear how they describe wraparound and really what we all think of when we think of high quality, high fidelity wraparound. What does that look like? I'll hit the play button. And you'll be glad to know this specifically mentions probation, which a lot of videos actually focus, on child welfare and don't
I didn't
sometimes leave
know
out probation.
what was going on with me. I was just mad all the time and hurting. I had a lot of push-down trauma, and it was seeping through every aspect of my life.
I started using drugs on a daily basis and ended up losing my children into the system.
We were joyriding in a stolen car. That's how I got caught, and that's how I ended up on probation. Who first introduced me to the wraparound program was pretty much my probation officer. I went to court one day and she said, I think this would be good for you. I think it'll help you a lot.
Through the foster care system, we met Pauletta and became involved in the wraparound team.
Usually the youth is referred, but this is a family process.
My client can't do well if his mom or dad is stressing over X, Y, and Z. So for my client to do well, we have to make sure that the family's doing well. And so the family can't do well if my client is acting out. So that's where I come in to make sure that my client is always taken care of and that the family's taken care of.
There are 4 phases of wraparound. The first phase is engagement. In the engagement phase, I meet the family and we talk about what wraparound services are, who would be on the team, how it would benefit them, and what their goals are.
The child and family team is really a key element of wraparound and is what brings everybody together to start the process.
Right, we're all here for you.
When you think support system, some people think family, some people think friends, but it can be a lot of different people.
They may be a coach, they may be a teacher, they may be a neighbor, they may be your best friend, they may be really the person who you know in that time of crisis you can call when you need them. We want anybody who is going to be there and be that champion for that child, we want to be part of that team.
Okay, great.
So a typical meeting would look like at someone's home or the office, whatever was comfortable for them.
And you tell us what your interests are, what your strengths are, and what your challenges are, and you share that at the table.
Don't be afraid to ask for support and help. We're not here to judge you. As a rep team, we're going to meet you wherever you're at, and we're going to help you along the way. And we've all had hardships, and if you're going through a hardship at the time, just know that you're not alone. It's easier to have that support system of 1,000,001 people to back you up than doing it by yourself.
I know when they first came in to support me, I had all those fears. They were referred by child welfare system. I had juvenile probation in my life, so I felt like it was just another set of eyes looking at where I was not doing so well. And actually after I got to know them and started to meet with them on a weekly basis and really saw their true kind of agenda of them being there to really want to help and wanting to learn what I thought and how I felt and what I wanted for my family, then I started to build that trust.
I never really been in like a program like that gives me support on everything I need. I kind of questioned it before I got on. I didn't really know Lawrence or any of the other people in the program, but once I started it and they start meeting, coming to my house, Me talking to my mom, calling me, just checking up on me. I was like, okay. So they care a little bit.
The wraparound process is very strength-based, and we want to find out what your strengths are and identify them so that then we can tap into those as we're going through the wraparound process. This isn't mandatory, so you showing up and you coming to the meetings or even listening and trying to find out what this process is about is a huge strength in itself. It's commitment. It shows that you love your child. It shows that you want to grow as a family together. So I think there's so many strengths in just even showing up.
Some of the goals that are developed through RAP is through a assessment process and maybe the diagnosis for a youth. And then there's information that is gathered from the caregiver as well as the youth.
My goal stayed the same the whole time. It was like my addiction, well, like my sobriety, my anxiety, which was through the roof, and independent living.
That was one of the plans to get me employed. I used to complain, like I need a job. I don't like having no dollars in my pocket. Another goal was to graduate high school.
In the planning phase, which is the third phase, we talk about how we're going to get this stuff done. So we have a meeting and we start planning things out. We always start with positives. We always start with what's working, and we kind of talk about a family plan. We have something called priority needs. We'll pick out 2 needs that are most pressing for the family and for the youth, and then we will work on those. We would do any updates, so everybody on the team would have an idea of what was happening or if any new information was shared. Then we would talk about action items, and those where we would assign tasks for each team member. And then the last thing we'd always do is set a date for our next CFT meeting so that it was always planned. And that we be consistent about our visits.
Yeah.
That'll work.
When I first started, they were scary. They were terrifying because I don't like eyes on me. So the fact that all eyes are on me and they were pointing out the good and the bad, and like, what is it, constructive criticism? I don't like that. But they pointed out the truth, and I would break down every CFT meeting.
I'm here to, help you to understand that there's obstacles in the way, but I'm going to support you in anything. But I will definitely be on you and hold you accountable for anything that you do. So you can make a mistake, but we're going to have that heart-to-heart conversations like, I know you can do better.
Oh, there were tears. I can guarantee that, and the challenges of just things that had happened in the past. It's hard to work through those.
There are so many supports in place that if it doesn't work this time, we find another way to make it work. So that's really that whatever it takes approach, and the really no eject, no reject approach, because whatever it is that you need, the team's going to work to help you get there. The facilitator is the one who really pulls the team together and helps to address those really hard conversations that will happen. It's not a matter of if, it's a matter of when they will happen. Because anytime you put all of those people in a room together and you're talking about very difficult issues, you need someone who's going to be able to support all of those voices being heard at the same time in a way to make sure that it's productive, but also then what is it going to take to support that youth?
Listen, this is normal. This happens. This is why we're here as a team.
We'll stick in there with you, and we won't leave you, and we'll help you through the rough patch, whatever that may look like.
They come to court with me. A lot of times my mom can't even come to court with me because she works. But they there every court day they were there representing me, so yeah, they a good support system. I just appreciate it.
As the conversations between me and Tamaria kept going, he was like, I'm tired of coming to court. I want to get a job, I want to do this, I want to do that.
I actually recognized change once I got my ID. I kind of felt like different too. I felt more mature. I landed my first real job at UPS. That's where I work now, and I got off probation finally.
Now he's at this place where he has a lot of goals, and he can reach them all, and he's willing to do them with the support that he has of the wraparound services, but he also knows that he can do them by himself with, the knowledge that he learned every step of the way.
I remember one night I ran out of my anxiety medication, and I was freaking out that I did not have them. And so basically, I used all the coping skills that I learned from wraparound. And I talked to my foster dad, and I got through it. When I have an issue in my life, I would tackle it head on. I definitely learned that through wraparound. I didn't know how to deal with my problems. Like, I've always just ran from them. I hated dealing with problems. But you guys kind of put it all in your face. It's good. I didn't like it at first, but I've learned to love it.
You have your own car, you got your license, you have your house, you have your furniture, you have your boyfriend. Life is good.
She has her grandma.
You have, sorry, that was most important.
Definitely the goals that we set, I did achieve.
And so the last phase, which is my favorite phase of all, is purposeful transition. So it's planning life for them after wraparound services closes. So what do they need to maintain their success, and how can we link them to community resources to help them do so?
I appreciate that.
There's a strength that comes when families are united, and RAP has shown successful statistics regarding this process that brings families together and actually give them the tools to be able to continue the work for their families even after we transition out of their lives.
It's awesome, isn't it?
I can remember going through it myself and going, wait, don't leave yet, you know, but really having the team to say, look, you got this, you can do this, and look at all that you've learned, look at all that you've accomplished.
Love you. Love you too, Dad. I'm very proud of you, all right? Thank you.
It's going to be work, though. I do want to say that no family goes into it without having some kind of work, and so it's not an easy process. But there's so many champions by your side that when you need it, they carry the hope for you. When you see at the end of it, you realize all that you've actually struggled through and gone through, and realize that it's something that becomes a way of life versus just another service.
I have my granddaughter now that is clean and sober. It just, yes, it is just a blessing to me.
You could tell them your problems, they'll try to help you as much as possible. So once I realized that, they were like family to me. If you got the choice and the judge says you could go to camp or you could work with the wraparound program, I highly recommend you join the program.
This was helpful for Victoria, and it, yes, it's there. If you want it, it's there.
You never know until you try, and it doesn't hurt to try, like, at all. I say go for it and go head first.
So before we move on in the presentation, I'm just curious, what does this video bring up for folks? Like success stories or times where wraparound has been effective, or maybe times where it hasn't been effective? What does it bring up for folks watching this video?
I think it brings up success. One thing that the young man said is that people in the RAP team were at his court hearings with him when his own mother couldn't be there. So I would say, I would classify that as success.
For sure, that's a great example. And that's something that we really highlight, an example of something we highlight as what high fidelity wraparound looks like. Say that again? Can you repeat the comment or sum it up for us? Oh, yes. The comment was that the young man talking about the wraparound team bringing him or going with him to court because his mother couldn't make it, and that's a definition of, or an example of success. And that is a really great example of high quality, high fidelity wraparound to be able to do that. And that just doesn't take the immediate wraparound team, it takes all of the administrative and financial structures in place to support the ability of the team to do that, which we'll be talking a little bit about today. Other reflections? Yeah, go ahead.
I would say to normalize the initial resistance, because both of the youth talked about that, and the RAP team was still there to support and work through that until the youth were able to come around and see the benefit.
Yeah, great example. So the comment was normalizing resistance at the beginning and still sticking with them. And one of the wraparound 10 principles is persistence. And I think many of you demonstrate that every day in your jobs, is persistence and sticking with whatever the policy change may be, or working with families, or whatever the difficulties may be. So yeah, great examples. Anything else before we move on?
Just real quick, from a professional standpoint of when you go in to work with these families, sometimes the situation can be very chaotic. And if you're just kind of by yourself, sometimes that's a little overwhelming. To where if you have a whole RAP team to support you as the PO, that's extremely helpful and beneficial as well.
Great example, thank you. So a comment about how many of the homes you go into can be a bit chaotic, and going in as a single probation officer can be a bit overwhelming, but having a whole wraparound team to do that alongside you can be really helpful. So this video was for those counties who were a part of the Title IV waiver demonstration project, and you may have had wraparound as a part of that in your county. This video and a lot of other stuff came out of those efforts. So just a little background about that. So we're going to talk like super briefly about the history of wraparound. I'm not going to spend a ton of time on it, but wraparound has evolved. Wraparound has been in California since the late 90s, which was one of the reasons why wraparound was selected to be the intervention or the model for FFPSA Part 4 Aftercare. But it's evolved a lot over the years because the funding structures and statutes and things like that have evolved. So I'm going to go briefly through that. But if you guys do have any questions, please feel free to stop me. You can raise your hand, chime in, and ask questions as we go along, because we're going to be covering a lot of different topics of wraparound, but in a short period of time. So feel free to interrupt and ask questions. And then these are some of the main pieces of wraparound history. Senate Bill 163 was passed in the late 90s, 2011 realignment, 2015 revision of the California wraparound standard. How many of you know that California specifically has wraparound standards specifically for wraparound in California? How many of you have seen those? Okay. That's been my impression too, that they're not very well known, and so that will be mentioned throughout the Aftercare wraparound discussion as well in this presentation, that really the California wraparound standards define high fidelity. So how many of you of hearing about wraparound or all this Aftercare stuff have asked the question, what is high fidelity wraparound? Has anybody asked that question? A few of you. So turn to the California wraparound standards because it's all laid out there. And then, of course, continuum of care reform and the expansion of some of the eligibility criteria for wraparound, system of care efforts, and of course, the Family First Prevention Services Act. So Senate Bill 163 in 1997 established established wraparound in California, and basically the funding stream at the time for California was quote-unquote placement dollars. So it was the flexible use of placement dollars, the placement rate structure, using the AFDC foster care funding. And it was also adoption assistance program payments or benefits were available to pay for wraparound services for families who were receiving AAP benefits. And really the intent of the time was to keep children and youth out of congregate care and support their transition from congregate care. And then 2011 realignment came around. Who's heard of realignment? Does that sound familiar at all? It's been a pain in the neck for everybody in a lot of ways. So basically what realignment did is it took those placement dollars from that were state dollars, it was a portion state, a portion county that could be used to fund wraparound, and just gave it all to the counties, which sounds good. However, it capped the amount. So instead of having however many youth were eligible for placement be the amount that the counties received, it capped that amount, gave it to the counties. And so a lot of counties experienced this situation where it was like, we actually don't have as much money as we did before realignment. And that's been our challenge at the state in supporting wraparound, in that this funding stream kind of dried up and most counties are using their realignment funds just to meet their basic mandates. And that includes child welfare and probation. Child welfare, we encourage child welfare to work with their probation partners to share those realignment funds, because really the expenses that probation incurred were included in those realignment expenses too. And like we say all the time, they're all the same kids, they're all the same families, and we need to be serving them together. There were no longer state-approved wraparound slots because it was a county-administered program. And wraparound savings, or quote-unquote trust funds, became monies that were included in the realignment funds. So before you could use your placement dollar, your state placement dollars, and if you didn't spend them all, you could scoot them over to your wraparound trust fund and use them on other things to bolster wraparound programs. And now because it's all realigned, it's all kind of county funding. So all of that has kind of undermined the fiscal structure of wraparound, which has led to some of the degradation of some of the fidelity of wraparound that we've seen from its initial inception. And this is just a little bit about how realignment works. So the money, instead of it being funneled through CDSS for distribution, it goes from the State Controller's Office, Department of Finance, to the county local revenue fund, to the support services account and the protective services sub-account. And the reason this is important is, how many of you are wraparound, like have some degree of administrative function within your organization? And how many of you are like direct line probation officers? Okay, so the reason this affects you is because if money isn't being shared or leverages resourced across systems, either you're not going to have a wraparound program, or it's what we affectionately term crap around instead of wraparound. So we all know that the money, wherever the money goes, that's really, everything follows the money, really. So we have to have strong fiscal structures in place to support high quality wraparound programs like what we saw in the video. And so this is all about where it goes, and we get into conversations with counties all the time about, are you shifting money from child welfare to probation? Is it going from this account to this account? And all of these nuances, it all affects it. And again, this is super high-level overview from the support services account, protective services sub-account. And so all of the funding that was wraparound that used to be kind of protected as a placement, as placement dollars. And if you had a youth who you wanted to serve with wraparound, they met the eligibility criteria, you could use state placement dollars to fund that. Now it's all buried in all of this that you see here in the protective services sub-account. And that's one of the reasons why over the years we've seen such degradation in the fidelity of wraparound, because this kind of secure funding source got buried in all of these really child welfare, foster care related mandates that probation also is subject to for youth who are placed in foster care, or if you're using any of these funds for any of your other diversion programs. So this is, so moving from 2011 realignment into the updating of the California wraparound standards. You all have this PowerPoint presentation. And you should be able to access the electronic version, so you can click on the links. If you can't get that, you can use the links that are in the PowerPoint to type it out in your internet browser. But in 2015, ACIN, All County Information Notice, I-5215 was published that updated the wraparound standards going back to 1999. How many of you have been doing this work since 1999? That's amazing. Thank you guys for your ongoing service and commitment to this work. And 1999, I think, like, man, wasn't that like yesterday? But no, at this point, it was over 20 years ago. So I mean, California wraparound has been around for a long time. There's about 40 overlapping and interrelated standards focusing on programs. So for those of you doing direct service, it divides it into the 4 wraparound phases that we saw up here and goes into what should wraparound look like in each of those phases. Fiscal standards, including sharing of resources between system partners and flex funds, administrative and evaluative standards. There's 10 wraparound principles that guide wraparound, California's integrated core practice model, and several other interventions, and I'm sure if you guys look through them, you'd be like, oh yeah, all those sound familiar. There's the 4 wraparound phases that were discussed in the video. And then wraparound, when it's implemented properly and to high fidelity, should be able to address 15 different life domains. And we'll get into this a little later, but we've seen wraparound in a lot of ways become almost entirely funded by behavioral health, which is great because Medicaid is a federal entitlement benefit. But what that means is it's basically become, in a lot of counties and providers, a mental health intervention that doesn't look hugely different from therapeutic behavioral services, TBS, or in-home IHBS, in-home intensive services. So in that sense, this is part of the fidelity discussion that we're looking to get into a little bit today and in general.
California RAP providers are basically high fidelity, the same model as high fidelity. Come 10/1, when we have to do high fidelity RAP for Aftercare, will they be, like, do they have to be certified in a certain way, or will they automatically come over and be okay to use?
Good question. Let's see if I can talk now. So the certification process is still under development, but it's progressing. So we have several statewide work groups that are working on the development of that. So many of the providers around California are really close or almost in complete alignment with the high fidelity wraparound standards, and some have some work to do. And that's a process that's continually evolving, and there should be an ACL released very soon that we're working on. We have a lot of resources we'll get into that really dives into what does that look like for high fidelity wraparound. But for current providers, there will be some degree of, we're not going to make counties go back out for RFP or anything like that immediately. We'll go through the certification process once that's developed, and we'll provide technical assistance and support around that. And with that...
We're not laughing at you, we're laughing at the clarifier of immediately, which means we will have to go there at some point.
Yes, and I'll get into that in just a minute. If it's okay with folks, we can take like a 5-minute restroom break, and so I can get my voice back, and then we'll reconvene. So the last question was about how do the high fidelity requirements and certification affect providers and current providers? And I swear my coughing fit was not an attack to avoid that question. So yeah, we're developing those right now. We have several work groups at the state level comprised of probation, child welfare, behavioral health, the associations, parent and youth partners, state workers that are all working on the certification, the provider certification piece and the county approval piece right now. And this is good news that you guys will be the first to hear about this because I literally just saw it on my phone. So we've been floating some trailer bill language, which is the legislative language that accompanies the governor's budget, that the implementation of high fidelity wraparound for Aftercare, it's proposed, it has to pass the legislature, but it's public now, so we can talk about it, that the due date is being kicked out, will hopefully be kicked out to October of 2023, so an additional year for that. So that gives everybody, including us at the state, a little bit of breathing room to implement that. So what we're looking at is hopefully releasing the ACL and behavioral health information notice with the certification requirements and the county approval requirements by October of this year. And then counties and providers will have a full year to take that information, pull it together, and begin making any adjustments to their wraparound programs as needed throughout the state. So that should be a decent amount of time, and we will also, like in true wraparound fashion, it will be a get started, get better approach as opposed to by this hard date you have to have high fidelity wraparound. We really want to support that ongoing evolution and continuous quality improvement. High fidelity, it's a process, it's a journey, it's not an end destination and then we're done. So that's what we're looking at right now, and we'll talk about that in a little while longer. But yeah, go ahead.
So if that passes, and I know it's all on that, then what's existing will just continue for another year?
Mm-hmm.
We'll have evidence-based wraparound if possible without high fidelity?
Right. So as it's currently set up, the current phase one will continue. Phase one, as it's described in the all-county letter that came out last year, and it's use existing wraparound programs or other resources, leverage other resources or existing wraparound programs to make sure youth exiting STRTPs have aftercare services. And that would just continue giving counties and providers more time to really look at the requirements that come out in October, and we'll likely release drafts like way sooner than that. So counties and providers have as much time to implement and make those changes as possible, because we know there's implementation and change fatigue, and we don't want we don't want to add to that, especially wraparound, which is all about like, going at the pace of the family, and we don't want to be like, oh, by the way, counties and providers, you don't even get that luxury. You got to implement tomorrow. So we're excited to be able to, or to hopefully be able to provide folks more time to move through that. Yeah, another question here.
Yeah, with the new legislation of the FFPSA, is there new emphasis on the assist portion of wraparound to help reduce the amount of, ticket costs there?
The assist program? The assist program is also in my unit, and I can never remember what it's called because we just call it assist every day, but it's basically a program focused on supporting the transition of youth. Initially was created out of low confidence group homes that likely weren't going to be able to convert to STRTPs. So the allocation to counties for that will be ending this fiscal year. But the resources, technical assistance, training, program level consultation will continue through UC Davis. But there's a lot of other funding streams that are kind of outside of the scope of this presentation that fill in the gap behind the ASSIST program for those counties who opted into the ASSIST program. Complex care funding, which who went to the complex care workshop yesterday. So several of you went to that. You learned about the complex care funding. Serves very similar purposes and populations as the ASSIST funding. And then there's also a proposed budget item in the governor's budget this year for family finding and engagement funding to expand that around the state as well. So there's a lot of funding streams coming up that can hopefully fill in the gap behind that program. Okay, so high fidelity wraparound standards, these are being updated for, they'll be included in the update in the next ACL, but the 2015 version is available in this ACIN. And they're being updated to clarify, but there aren't significant changes. So if you pick up this ACL or this ACIN I-5215 to understand and to really think about, is our wraparound program in alignment with high fidelity standards? Am I practicing wraparound? Am I participating in a way that's high fidelity? If you look at this ACIN, it covers a lot of that. And then there is CCR, Continuum of Care Reform, and Wraparound Eligibility Expansion. Again, one clarification that we always are trying to make is wraparound really could be available to anybody. It's the funding streams that fund wraparound that limits the eligibility criteria. And as you can see here, the eligibility criteria at the state level, is almost any youth. It's really the way that your individual counties put the parameters on your county's specific wraparound program. So if you have questions about the eligibility criteria, you're welcome to reach out to us, but a lot of times it's the counties and their own internal processes and funding mechanisms that dictate the eligibility for wraparound. So the wraparound rate is the same or up to the STRTP rate of $14,000 per month, and that would be what the provider receives to on a per youth or per case, per family basis to administer wraparound. And AB 404 added these additional eligibility criteria. I'm not going to read it word for word. But basically, a youth who's adjudicated as a 300, 450, 601, or 602, a youth who's subject to the 602 petition and is described in one of those sections of the WIC code as being at risk of placement in out-of-home care. A child or non-minor dependent, so AB 12 youth are also eligible for wraparound, who is currently or who would be placed in out-of-home care, and a child participating in the adoption assistance program. So this is pretty wide in terms of eligibility. It's just a matter of does your county have realignment funds that are available to be able to fund youth in all of these categories and families in all of these categories to receive wraparound. And that's what the next teal color says, that it's basically to claim the STRTP rate, a youth has to fall into one of these criteria. But there's a lot of different ways to fund wraparound to expand the eligibility for the program.
You have a question.
Oh, question. There we go. Yes.
You indicated that the county is basically adds restrictions to the eligibility requirements in excess of this, is there anything that we can get from the state indicating exactly what the state requires? Because in my area, that's one of the problems that we're having is, for example, it's requiring that the youth has detention findings. It's indicating the kid has to be in custody in order to be eligible for a program to help them stay out of custody. So, with all the diversion that's going on right now, to not put kids in the criminal justice system and try to divert them away from the criminal justice system, there's a lot less kids that would otherwise be eligible for this because our juvenile hall population has decreased immensely. So does that sound familiar on the state level where you're at, or?
Yeah, so the question was, can we issue any state guidance or clarification to help clarify what is the state's eligibility criteria? And remember what I said about realignment is it realigned all of that funding to the counties. So wraparound, for the most part, is a county-run, county-administered program. So we can help provide technical assistance and troubleshoot what the statute says. But, I mean, if counties have funding streams and funding mechanisms set up that limit beyond what this says, I mean, that's up to each county based on how they fund the program, and because it's a voluntary county program. So we can definitely help with that, but it's not something we can mandate this is how it has to be done. The only state mandate that exists for wraparound right now is the aftercare piece. But that's the headache that I referred to earlier, that is 2011 realignment, is the counties got less money and the state we have less ability to hold counties accountable in situations like this, or even to provide support to counties to help them expand their eligibility criteria. But definitely you can refer your counties or providers that you work with to us, and we can help troubleshoot and provide technical assistance as much as possible. So especially for those of you who are in administration within your county, County Fiscal Letter 2021-94, which was issued, I think last year or the year before, basically goes through how to claim wraparound and all the realignment funds. It's a really technical letter. Great to put you to sleep before bed. It's amazing for that. It has some good information in there too. It's really detailed, really technical on the fiscal side of things, but for those of you who interact with your fiscal counterparts, it really helps in supporting here's how to fund wraparound, and maybe even help to expand eligibility of your wraparound programs in your county. There's also a webinar that goes along with it, and both of those links are in this slide. I'm not going to go through it right now because I would put all of you to sleep, especially after lunch. And then this is a little overview of the Family First Prevention Services Act, which passed in California. It passed in 2001. I lose track of the years. It's all that pandemic haze. It passed during the pandemic. AB 153, also as it's known in California. So there's 5 parts. I'm not going to go through all of them, just the main ones that folks may have heard about. Part 1 focuses on prevention services and allows federal Title IV funds, which you all may know is pretty much just reserved for room and board of kids in foster care, to fund activities to prevent entry into foster care. So to fund those youth and children who are at risk of entry into foster care. And really, in order for a county or a state to use the federal Title IV funding on a specific intervention or service, it has to be listed in a federal evidence-based clearinghouse, which I think there's maybe 30 in there right now. Wraparound was just listed in there, which is great news. There's a lot of administrative stuff that has to align in terms of technology and our state prevention services plan in order to make this happen. Oh, it's coming back.
So we were invited here today to talk about kind of the practical application of what happens with wraparound in our counties and some of the barriers that we've encountered. So we'll start first with Riverside County. So I thought we were unique, but you'll have to tell me if that's true. Our wraparound team configuration consists of your typical clinician, a behavioral health specialist, a parent partner, and also a probation officer. So we have probation officers that are embedded into each of our teams in our county, and they serve such an integral role, as you imagine, because they're freed up to have the opportunities for more intensive supervision with those clients. I know that we've all seen our client numbers drop, both for placement but also for just general wards. But this provides a unique opportunity where they get to learn all the dynamics and elements of the model, and they are an integrated team member. And I'll tell you, as someone who was a part of overseeing wraparound for a period of time, it not only influenced them and how they manage those clients, but there were so many wonderful things that they brought back that they carried through their case management even when they weren't on the team. You might wonder, how did we get that funded to have, we have a total of 13 positions that are actually funded through an MOU that we have with our behavioral health. And it took a little bit of work to find out how that happened, because it happened so long ago that many of those people are enjoying their retirement now and all that good work we're benefiting from. But we have an MOU with our behavioral health agency, and they use realignment dollars in order to fund that. And so, as Daniel said earlier, there are realignment dollars that go to your DPSS agencies or your social service agencies, but there's also a cross-section of realignment dollars that also go to behavioral health. And it speaks to partnership. There was a vision that people had years ago about how important it was to try to prevent placement, and we are continuing to realize that benefit even today. Next, I want to talk about the training, both internal and external. So my encouragement to you, I imagine there's varying degrees of understanding of the model in this room, but what I would encourage you to do is, if you're somewhere in the novice range, that you take time to learn it. And that will play into some of the feedback I'll give to you later. But within our county, there are internal trainings that are provided to orientate both the probation officer and the team member, new team members, to what the roles are. There's also lots of resources available externally. Some of you may know, right, UC Davis provides excellent training opportunities, but I would just encourage you, if you're new to wraparound, to really take advantage and learn the roles of the team. I'll do a shameless plug on behalf of my coughing colleague over here, but the Partnerships for Wellbeing, we call it the Wraparound Conference, but it is Partnerships for Wellbeing. It's coming up shortly, and that is a wonderful conference. I was sharing with Daniel, it's been some years ago that last time I attended, but there's still things I'm using today that I learned there. So wonderful, but taking advantage of the training, and I think that's usually embedded in our departments with anything like this. Next, I'd like to talk about how referrals work within our department. So years ago, when we were looking at our system improvement plan, we realized that there was a higher than usual rate of clients who were exiting placement who were going back pretty quickly. And so at that point, part of our system improvement plan was that we began post-release post-placement referrals. So we started at the 60-day mark. We provided that referral to our counterparts, and you may think that's a lot of time, but sometimes county government may work slower than we'd like, so we wanted to give plenty of lead time to our partners to be able to take on that referral. If there was a waiting list, we would hope that we got that client on that waiting list. They would meet the client at the placement, they would do an orientation, and then our hope and goal always was that there was this warm handoff, this smooth transition for clients that were exiting placement. And again, that was a partnership that we had to come to an agreement with our behavioral health department of, you're serving this population that's pre-placement, would you be willing to take on and build capacity with us to service this other client? And, unbeknownst to us, not knowing FFPSA was on its way, we felt very grateful that there were some really astute individuals who are looking at the data and saying, hey, how can we better serve these clients? As I mentioned, we looked at our SIP, but we also looked at other data related to clients entering wraparound. And what we saw is that clients were falling out at typically before they reached the 30 or 45-day mark. So we looked at what was going on there. And there was sometimes a gap in connecting the family with the wraparound team because there were waiting lists or there was just other circumstances. So that afforded us as a probation department to problem solve around that. So what we did is that we assigned a PO immediately. And we directed them to make their sole job in those first 30 days to make as many contacts with the families to really begin creating a rapport, creating connection, figuring out where the gaps were, and seeing how much work we could do until the team was able to start. We also pulled some data on why most of our clients were not successful in wraparound, and we found that there were two factors. One was substance use, and the other one related to their education, being violated for not going to school, and that usually led to their whereabouts being unknown. So we were able to use the data to encourage our staff to really look at those things. If they saw a pattern or history of substance use or some issues with school, it wasn't just showing up at the house saying, you really should stop using drugs and I really need you to start going to school. It was finding out the reasons why. Why was that happening? And that helped us gain some momentum and keep more families into wraparound. Next, we'll talk about partnerships. So I've mentioned it a little bit already, is that I don't know if you've ever experienced this in your career, but sometimes we're not on the same page. We're not even in the same book or in the same library. And so partnership is important. And I got some really great advice from our chief. He told me some years ago that as long as you could focus on the data, as long as you could focus on what was objective, it stopped being personal and it neutralized the conflict. So I definitely honed my skills sometimes through my time in wraparound about focusing on the youth, right? You could neutralize a conflict in your partnership by saying, so tell me what you think is best for the client. These were my thoughts. And it stopped being about someone denying the flex fund request for the refrigerator because they didn't know if that was a sustainable thing for the family to carry on. Maybe I'm using some language you've heard before, but it helped bring us back to center. But the partnership, I'll say there were some, as I mentioned, some conflict, but there were people that were embedded into our collaboration, right? Our behavioral health staff. Maybe sometimes you have a lot of them, sometimes maybe you only have one of them. But when you find that person, you don't let go. Don't let go of their hand, no matter how windy and gusty and tumultuous things come, you just don't let go of their hand, and you commit to each other that you will always keep the child and the family at the center of what you're doing. And we have been fortunate enough to have a partner like that. We have weathered some storms. We have had to provide a lot of feedback about our concerns of fidelity of wraparound to our families. And this is where that training piece that I mentioned earlier comes in. So I don't know if they knew what they were getting or if they got what they were bargaining for. When I was able to go to multiple internal trainings, 3 days long, I got to watch what each person on the team was supposed to do. I watched them practice what they were supposed to do. I learned wraparound terms. So when I showed up the next staffing that we had, and I would ask a question about, I noticed that the Jones family, that we haven't talked about natural supports. I learned about that in that training a couple of days ago. Tell me, are there some barriers to those natural supports? Sometimes we need to speak their language. It needs to be sometimes on their terms. It helps them connect back to their own principles when they also see someone who's making the same kind of effort to learn the model too. So going back to the importance of that training. The other thing is, for us, when we saw that there might be some gaps, we came closer to the problem. We came closer more frequently. And that meant, as I said, attending maybe weekly staffings or asking for additional meetings. I just want to express the urgency. We are fighting for the future of children and families, and you may be the person that brings the light bulb moment where lightning strikes, who makes the magic happen, who helps them see the kind of clarity that they need that will change the trajectory of their life. And I'm going to tell you, if you come with that perspective, it's contagious, right? And it's hard to have internal disagreements when, like I said, we continue to focus on the potential that we can have with that client and that family instead of, Medi-Cal billing, and can that person actually bill for that phone call, or can they bill to show up to that house to try one more time to get that referral, that referred family on board. Some of the other things, barriers that we encountered was, I feel fortunate to have worked with a group of probation officers who treated all of those families like they were their families. And sometimes when an agency isn't completely responsible for the history of that client and that all that work that maybe your agency has done, there's not as much ownership over it. And so you might see in some of that case management opportunities for that other agency that's providing it to take more ownership, to make sure that they feel like that's your family too. We also noticed sometimes there was a more frequent request for a violation of probation. For us, we're really looking at what's the end goal. If we are going to violate a client, why are we doing that? What are we changing? If you're going to recommend the same thing, is there some other strategy we can employ, keeping the client in the home to do that? It's amazing how if you take a violation off of the table and say, okay, let's come back together, how incredibly creative people can be. And so I just want to encourage that, is that depending on where you are with your providers, is to ensure that they aren't using that as almost a reprieve from the team because they're feeling like they're constantly in crisis with their with that family, that we don't unfortunately provide respite in that way. We need to use those things correctly. And then lastly, we'll talk about how our behavioral health partners are planning to level up. So the great part is that, as I said, there have been tumultuous times with our provider, but there's a person who we haven't let go of their hand, and we continue to weather this storm. And they are just as dedicated as we are to make sure those clients are getting what they deserve from each of our entities. So in preparation for high fidelity wraparound, they have actually assigned a supervisor level individual from behavioral health as the fidelity monitor and coach. They have already begun ensuring that she has all the trainings that are available. She is also working collaboratively within their agency and our agencies to come back to the basics about wraparound. We just actually this week will finish our retraining on the wraparound model. So every person that's doing wraparound has now officially, as of tomorrow, their training will end, have been retrained on the basics of wraparound. They also are going to continue to provide booster training throughout. There's going to be monitoring so that there can be coaching. So as I mentioned to you about the importance as a probation agency of learning the program, it's also important to ensure that the folks on your provider side know the program, are coaching to it, so you don't have to continue to be the person that is providing feedback. So there'll be oversight and coaching on any of the gaps. And that monitor will continue to receive training and coaching herself so that we can stay on track for her to be, right, the keeper of the line. So we're excited about continuing to partner with our behavioral health agency and hopeful of what this new world of high fidelity wraparound will bring. Are there any questions I can answer regarding that? Yes. Great. So we actually used to have that written into the MOU, but we felt like it could be prohibitive because, as we know, a client who's in the transition phase of wraparound does not require the same volume of time and meeting. So I'll say, as a probation manager, I would love to see our caseloads between 10, at the most 15, if we have a couple of clients that are transitioning. So that, for me, would be ideal. But I also know our behavioral health partners who provide our wraparound have these many other duties, right, that are so different than what it is that we provide in probation, billing, and paperwork and plans. So for us, that's what it would be. Yes.
You mentioned that you assign a new PO when they come to this wraparound program. So do they essentially, when they enter the juvenile justice system, do they start out with one PO and then when they're eligible for this program, they're assigned another one?
You're exactly correct. So, yes, and we want to do this warm handoff between the case carrying PO and the wraparound PO. So some of those first meetings are done together. They'll go to the house together so that there can be some transition. But the key part is during until that case is open with wraparound, they're actually co-managing the case. So they get more time with two POs, kind of learning each other's styles that can help create a more smoother transition for the family.
So if you have a youth come in and you know they're high need, high risk, they're definitely going to be eligible for RAP, do you still start out with a supervisory PO and then transition to the RAP PO?
Right. So the way that it goes, I guess a circumstance like that would actually dictate where the client is in the court process. So for instance, if we get a new referral and the client is never been on probation but comes in with a high risk, there would be no reason to assign a supervision PO just simply to wait for wraparound. So we would ask for that case to be sent directly to us from investigations. There are times, for instance, when our practice in our department, when a client is in placement, they only have this placement PO. There are times that they will keep that PO because of just the juncture they are in their rehabilitation, and there will be two. So they will just work with the family together. Very good.
All right, thank you. Thank you, that was great. And I mean, it's always so meaningful and necessary to hear what's happening both at the state level and the local level so we know how that's being operationalized. And thank you for saving my life as I choked again. So I'm going to go back a little bit and really highlight, Rachel, what you were saying around relationships. And the relationships really parallel each other at all levels, at the state level, at the system level, the county level, providers, direct service level. And to really have a high fidelity wraparound program, that partnership has to exist between all agency partners, you know, with child welfare, probation, behavioral health. Those funding streams all leverage to really pull together and create a high fidelity wraparound program. And for those, how many of you are familiar with, have heard of AB 2083, the System of Care, Memorandums of Understanding between the agencies, a few of you? So in a nutshell, that's a state requirement that all of those system partners have to have an agreement, so there's less of, you know, the scarecrow from the Wizard of Oz pointing this way, and no, you know, it's you go through that door, no, you pay, no, you pay. That needs to stop. And the System of Care 2083 MOU process, the intent is to address that between the systems, including a dispute resolution process. And although wraparound is not intentionally written into the MOU, we encourage all counties to intentionally write wraparound into your system of care MOUs, because wraparound is inherently a system of care intervention. And so this slide really talks about leveraging, why are we leveraging FFPSA to uplift wraparound? And these are a lot of the reasons described. Wraparound has been in California for many, many years. We have a lot of knowledge, like Rachel described, and sure, there's been highs and lows like a roller coaster, but wraparound has been here, and there's a lot of knowledge around wraparound, both in terms of overcoming barriers and in terms of direct knowledge. Let's see. So, and I may have to turn it over to you guys now. So sorry about that.
So actually, I want to start with a question on what Rachel was talking about, and how many counties are similar to Riverside where you have a RAP probation officer who's trained in RAP? So a good number. We're like the rest of you, we don't. We have our probation officers, and then we have our RAP teams. And I'll start with just a general overview. Our department has been in flux a lot over the last year and a half or so, trying to figure out what makes the most sense for continuity of services for our youth. And so we are now sort of settled into our new normal, where we have investigations, and then straight from there, after the detention hearing, the youth comes to their probation officer, with whom they will stay, short of being removed from home. So through the process of intake and supervision and dismissal from probation, they will have one probation officer for purposes of continuity. If they happen to be removed from home, they come to our unit. And again, short of anything happening, ideally, they will stay with their probation officer in that unit through dismissal, which means placement and reentry. It's one probation officer who helps that youth reenter into the community. To us, it means that the probation officer maintains relationships with the family, maintains relationships with the youth, and prepares the family and the youth for that reentry process, because it can be difficult. Some of our parents, unfortunately, withdraw during the time that the youth is in placement, because they're either so fed up with their behavior at the time when the youth is removed, or there are other barriers. So we work on trying to figure out during the time that our youth is in placement on what exactly is happening and what kind of aftercare services we need to provide. And part of it, probably going out of order on my slide, but part of it is we've actually utilized FIRST services for quite a while, and it is also not uniquely a Seneca program anymore. We're using a different provider now, but it's a service that steps in about 90 days prior to the youth's removal and engages the family directly. What do you need? What services do you need for your youth to successfully reunify? Do we need to figure out your mental health? Do you need to figure out your physical health? Do we need to connect you to any services? How is your housing looking? How is everything looking in order for your youth to come back? And then the second piece comes in with the youth is about at the halfway point during their STRTP stay, they start working on their reentry plan. And we like to be special in San Francisco, so our reentry court is a boutique court. It's a collaborative court, and the youth presents their reentry plan. And that reentry plan has to be accepted by the court, and at that point, the youth can reenter back into the community. So what that does in our eyes is it gives the youth and the family some authority over what they're doing, some ownership over how they're reentering into the community. And with that, hopefully, there's a little bit more of a buy-in into the services. They agreed, they wanted to participate in these services. Do you want to chime in on that, or?
I was just going to take you through the day of a PO and reentry and placement, so I'll let her finish.
You let me finish on the administrative aspects of it. Okay. So I think recently we've seen a loss of a lot of services, and that comes with the smaller numbers of kids in placement, because providers are not simply holding the slots anymore for our reentry youth, and they're utilizing those dollars elsewhere, and they're utilizing those therapists elsewhere. So that's kind of how we lost FIRST services through Seneca, because we only have 3 kids in STRTPs right now, so they're not going to hold a therapist for them to maybe engage in those services. But we do have, at the same time, more available services coming in. So some of the services that were previously only available to our pre-adjudicated youth are now available to our post-adjudicated and reentry youth. Things like evening reporting centers are now available to our reentry youth. And simple home detention management, where they get curfew calls, or they get very basic case management on a very low level, where the case manager just checks in to make sure their attendance is looking decent, they're home on time, do they need anything? And we build from there. And we have a pretty robust relationship with the Center on Criminal and Juvenile Justice, where they provide a lot of our reentry services, pretty robust case management for reentry. So they work on very real things, like making sure that the kids are oriented towards a future job, hopefully. So they work with them on getting their guard cards if that needs to happen. They work on mock interviews. They work on getting their social security cards and their IDs and their funds for them to get their driver's license. So we try to bring everyone at the table together, and that's where the Seneca piece really comes in, because they help to bring the team together, make sure there's no duplication of services. Everyone has a voice and a role at the table. So our Seneca teams do a pretty good job of managing how the team is working, that the family's not overwhelmed with services, and at the same time, making sure, do we have psychiatric services in place? Do we need medication? What exactly do we need? Unfortunately, we do not have enough clinicians in our RAP services. And so as we sit here right now, we have a 2 to 3 months wait for a RAP team to open, which can make a difference between the youth staying in the home or being removed, because we also use RAP as a preventative service. And in addition to that, the way those slots are allocated is by who is higher need. And our reentry kids are frequently just not there. Youth who are about to be removed from home are the ones getting the first slots. So we kind of have to piece together other services, and one of those is still provided by Seneca. It's our MRT, which is the mobile response team, and they're a crisis team. But once they respond to the home, they open up for 90 days. And they mimic Seneca services, and wraparound services. They're open for 90 days. Not quite as robust of a service, but there's still something available to the family 24/7. You can call out, the mobile team will come out, they will support you through the crisis. They will hopefully get you to stay in place until that Seneca team is in place, a wraparound team is in place. We are very thankful and very lucky, as Rachel was saying, partnerships are huge. And so we have a really good partnership with our behavioral health and with our child welfare as far as Seneca or wraparound services are concerned. On other issues, we're definitely not in the same library. But at least as it comes to not fighting for money for preventative and aftercare services, we're lucky enough to be in a good spot with that. And also for our reentry court, our judge is very much against violations. So we do work tirelessly before violating a youth. And I think that was a huge shift for me when I came from supervision to supervised placement, and my probation officers were saying, no, we don't violate kids in reentry. What are you talking about? Like, what are you doing? So I had to get used to that collaborative approach. But as Rachel said, that can make a huge difference. If that is not looming over someone's head and they know that they might be failing with school, but they're doing these other pieces. Maybe they reduced their substance abuse. Maybe they are finally engaging in some anger management. Maybe they're finally doing something else, and we're trying to focus on their strengths, just like the wraparound approach, and go from there. Sometimes we unfortunately still fail. Sometimes 4 days after release, they commit 3 armed robberies. That happens too. Nothing Seneca can do about that. But we really do try on making sure that we exhaust all of our options at reentry before we violate. And I ask my probation officers the same question, right? Before you file a violation, what is going to be your recommendation for disposition? Because if we're keeping the same disposition, we're not violating this kid. We're continuing to work with them. Some of the other barriers that we're looking at right now is just with the new laws, our population is so much older. And I don't know if you guys are looking at the same issue, but our kids are exiting placement and they're closing on them being 19. And they're simply not eligible for some of the services that our traditional population is eligible for. And also a huge population is not re-entering back home. So a lot of our kids are going into another planned permanent arrangement. They're going to THPs, they're going into SILPs, they're living God knows where, but they're not going back home. And so trying to figure out services in those situations can be extremely tricky as well. Because when we're sitting in San Francisco and our kid is looking for a psychiatric service in Exeter, we're not exactly familiar with those services. So we've been navigating a lot and recently opened up a new partnership with our public health, where we now have a psychiatric nurse and a foster care nurse assigned to us, and they help us navigate medical issues out in all of other California counties that we're not familiar with. So it again goes back to building your partnerships. And again, I think one of the biggest barriers is trying to provide services to a smaller population. How do we maintain the same number of providers or the same availability of slots when we just can't guarantee that they'll be there in 6 months? And our plans to expand Aftercare, I just recently learned, we are writing another MOU with our child welfare to bring back family partners for placement families, which I think is huge. So that's kind of where we are, and Jamaica's going to walk you through a day in the life.
Well, everything was said already, so see you guys later next year. So as the PO in the reentry unit, kind of just give you a little history first. So when I transitioned to J Crew, which is our reentry unit, it was during COVID, and I often went to Kwanzaa, who's actually so gracious to be here today because he was one of the founders of the unit back in 2013. And it was a unit designed to basically collaborate, and it was for our log cabin youth that were transitioning back home. And it was designed to basically decrease the amount of youth that would re-enter back into placement. And so now that's what I'm doing. I am rolling it on out and continuing to grow as a PO and fostering these new collaborations with our community-based organizations. The day in a life for me is I'm embedded in my kids, and my supervisor will often tell me that I need to take a step back. But in order for our kids to be successful, there has to be a constant. And I want to be that constant for them while I have them for that short period. I want to be the person that they can call and say, hey, come to my basketball game. I need the support. Because oftentimes they still don't have the family support that they need, that natural support. So I'm often that person. I'm often called the soft PO. I don't like violating my youth. That's just, I don't, in some situations, yes. But in most, I think that we need to work with the youth and the families and really dig and dive deep into seeing what the root of the problem is. So for me, I'm constantly on the phone. I'm constantly at schools, at homes, wherever I need to be for them. It could be at the Starbucks. I've met my youth at Starbucks because they didn't feel comfortable with me coming to their home for the first couple of times, so we'll meet at Starbucks. So really just being there for everything. That's really my message to all the POs that are out there. Just being that person that they can rely on, I think will create a lot of success. That's it.
All right.
Oh, and a lot of paperwork. Sorry. Let me not forget that. A lot of paperwork, and I forgot one thing. One barrier that I want to say that I'm afraid of is housing. I supervise the secure track youth which is the youth that would typically go to DJJ. Those youth are now in San Francisco County, and we're supervising them, and they are committed to juvenile hall for a long period of time. So my youth may be there from 17 to 24. And when they transition out at 24, where are they going to go? We're going to send them right back to their communities where all the trauma happened. So that's what the barrier that I see in the future is we're going to send them back into the very community that had to do with the offense. So that's the barrier that I see is housing. I saw a question.
For your reentry caseload or reentry foster care, what are your numbers?
We're about 10 to 12 right now on average per PO. I do have to say that probably one of the biggest pieces of our current placement reentry is long-term RFAs. So they don't have a parent, they've always lived with that grandma. We RFA'd the grandma. Grandma does not want guardianship because the money's gonna go away. And so they stay open for 3-4 years in that RFA.
Yes.
I have a question. I heard a number regarding youth in short-term residential therapeutic program, and I wonder if there's been data established or research done on how that compares to counties across the state and the contributing factors to that.
I think that's $1 million question these days. The numbers for youth in placement and SDRTPs has dropped drastically for every single county that we talk to. Some counties don't have any youth in SDRTPs, and I think San Mateo County has a very low number, Alameda. So all of our surrounding counties have an extremely, I don't think we've ever seen numbers to be that low. And I think it remains to be kind of seen there are no current studies on what has caused this drastic shift downward in juvenile crime. I can tell you that approximately 70% of our cases never make it into the courtroom. So we have 3 very robust diversion programs, and our DA's office, upon review, diverts approximately 70% of our cases at this point. So only the most serious cases, 707Bs, and sometimes not even on the first offense, will make it to a petition and a probation officer. So that's what's driving the numbers down a lot for us.
Other questions?
Oh, I have placement, secure track, and reentry. So I have a youth in STRTP right now. I have 3 in RFAs, and I have 4 for secure track. I may be missing some.
Some have fallen through the cracks.
Right, I may be missing some, but we failed to mention earlier that in the J-Crew unit, we also have 4 social workers that supervise our AB 12 youth, our 450s.
They're a separate unit now.
Oh, yeah. Sorry, I'm still getting used to the separation. I'm having the anxiety.
But we do have 1 social worker in our placement and reentry unit. She is our assigned RFA social worker. So for families who are not attached to an FFA, primarily for family-based RFAs, she is she is their social worker. And her second job is to help our kids who are transitioning to AB 12. So she steps in, again, about 90 days prior to the transition to AB 12. She makes sure that they have their Medi-Cal card, their Social Security, their driver's license or ID, all the paperwork is in order. We bring in our AB 12 social workers about 45 days before the transition happens. There is a warm handoff. There is getting to know you to make sure that that transition is smooth, because we don't want to lose the kids right in that transitional period. Yes.
Does that social worker then supervise the AB 12?
No. So the social worker who comes in 45 days before, we usually engage them into the pre-exit CFT. That social worker, yes, they will come on and supervise that AB 12 youth. But the placement and reentry social worker helps prepare that AB 12 file and make sure that all of their paperwork is in order. Because again, there's a lot of paperwork, so someone has to help our POs out with that paperwork. And we're very thankful. So Kyle is actually one of our AB 12 social workers. He's sitting right next to you. But we're very thankful to our social workers. They bring a huge support to the probation officers and to the youth. Because again, once they're transitioning from being on probation to AB 12, it's a huge shift of what's required of them and what's not. And so it helps to go through a social worker so they start getting that different feel for how they're going to be dealt with or handled going forward. And just to, Jamaica's caseload is unique and it's not meant to be that way. Eventually she'll transition out of her placement cases.
I'm waiting.
No, that's okay.
Is there a secure track youth facility in San Francisco County?
Yes, it's inside our juvenile hall. Yeah. We did not. That's a myth. Our juvenile hall was slated to close in December of 2021, but since no alternative facility was created, we continue to function, so.
I saw another hand, but I don't know where it went.
Oh, right back there.
I should have known, that's my favorite leopard. Yeah.
Justice involved. There's going to be two separate work groups that you guys might want to keep track of. And these work groups are going to be launched sometime between July and December of this year. So I think having probation's voice at the table for these youth and babies.
One pet peeve that I have, and I hope that it changes when that work group goes into effect, is that our youth do not fit the definition of homelessness. San Francisco has an enormous budget for homeless housing, and none of our kids qualify for it, unless they sleep on the bench for a certain period of days.
So that is exactly but I will tell you, the leadership at CPOC worked in San Francisco, so they're probably aware of that.
Yeah.
But it's good to bring up, and it's things like that, that, just need to be brought forward and discussed in those groups, because those are the things that they need to work through.
Yeah.
We're going to need to work with the state.
We've advocated heavily, or I personally have, with the Department of Homelessness, to either change the definition or amend it for our day population and our underage population, because they need to be able to qualify for that, for those housing dollars.
And the U.S. Interagency Council on Homelessness is revisiting their strategic plan, because a lot of what's driving the local definitions is from the feds, because they get their money directly from the feds, and so they're looking at revisiting that as well. And so we actually put forward, I'm with the Council on Criminal Justice and Behavioral Health, we put forward that input to them a couple months ago when they were doing a national call for input. So, and I think that the Secretary Fudge, she has a very keen interest in this population for the whole age span. So it's a good time, but I think having these voices at the table, like all of you guys there advocating for me, really good, just to keep the momentum and making sure everybody recognizes and keeps feeling the need. So.
Absolutely, and I think, no, that's amazing. It's an amazing resource that we definitely are going to look into. And I think another thing that they really need to consider is not just ending homelessness, but preventing homelessness, because so many of our kids don't qualify for those homeless dollars. They end up homeless. So that's very unfortunate.
I promise this is my last barrier. Minority therapists. Well, everybody said enough right there.
Yeah.
The response was good enough for me. We have to recruit. I don't know what we need to do, but minority therapists is and cultural competency needs to be embedded.
With the Children and Youth Behavioral Health Initiative, some funds have been allocated to the Healthcare Access and Information Department. It used to be called the Office of Statewide Health Planning and Development. So they're looking to build out workforce for juvenile justice, and they're accepting feedback and looking to really try to create a workforce that is, responsive to be able to address a lot of the equity gaps that we're seeing in the state. So
Thank
it's on
you.
the radar, but again, more input and the more input is better.
Thank you.
That's great, and I'm hearing opportunities for advocacy, and we always need folks who are direct practice, like boots on the ground, plugging into those opportunities for sure. So I'm going to call one of my colleagues, Chris Petty, up here to help me, just in case I have another coughing fit, so I don't have to. I've run out of people to defer to here in this presentation. But thank you guys. That's great, localizing all of this, all of these changes that are coming up. And really, I think it highlights reentry, aftercare, whatever you want to call it. It's hard. It's really hard to make that transition for agencies, for families, for youth. And in a lot of ways, that's the reason that it was included in the Family First Prevention Services Act. I'm going to try and fly through all these as long as I can, and then Chris will hop up here if I start, hacking in the corner or something. So a part of this FFPSA. It's in a lot of ways CCR at the federal level is basically how I describe it. I'm not going to go into a lot of detail about it, but it really adds this aftercare component of a requirement of 6 months of aftercare after a youth exits from an STRTP to a family-based setting. A few caveats: there's nothing that says anything that a case has to be kept open for a youth to receive those aftercare services, since many probation cases close when the youth exits the STRTP. So the funding that's been allocated can be used for youth, whether there's a probation case open or not. And then we are exploring how can we get wraparound funded under FFPSA Part 1 as a prevention strategy that's more well-funded to prevent entry into foster care. I think you've heard a lot today about why we've selected wraparound as kind of the model for aftercare under FFPSA. Long history, lots of resources already dedicated. Chris will talk about some of the resources we have available through UC Davis at no cost to counties and providers. And a new logo will be coming soon. Can I turn it over to you now?
Sure.
Thank you.
All right, so let's take a look at some of the, as it says on the screen, a nutshell, FFPSA Part 4 aftercare requirements. So many of you, I'm sure, know October 1, 2021 was the magical date when the state, we asked you, Child Welfare Agency, Probation Department, Mental Health would come together and develop a plan. Will jointly provide and arrange for and ensure the provision of the 6 months of aftercare. And so, as Daniel announced earlier on a slide, you can see that it said 2022. Pending legislature approval, it would get bumped back to 2023. But
I haven't even had time to update the slide yet. It's so new.
Right, brand spanking new. So when we talk about high fidelity wraparound, it encompasses family, youth, voice, and choice. It inspires transformation and hope in families' lives, informed by data, fidelity tools, admin data, CANs, which many of you I'm sure are familiar with, and we want to be sure that it's consistent, the model is consistent across the state of California, and it's also based on the wraparound standards, which we've talked about earlier. Okay, so what, as many of you have turned into our unit, your wraparound plans, and they've been reviewed by DSSS, and also the Department of Healthcare Services is in the process of reviewing them as well. And we've learned certain things. With strengths, there clearly is a firm understanding of what wraparound is and what wraparound has the potential to do. There's a strong commitment to partnerships across system partners. There's longstanding contracts and relationships with wraparound providers. And most counties, 42 out of the 58, have an active wraparound program. And what are some of the challenges that we're seeing so far? No big surprise, right? Staff recruitment, retention, turnover is a big issue. Over-reliance on Medi-Cal billing and underutilization of additional and more flexible funding streams. We've talked about that a little bit today. There's red tape and confusion regarding sharing resources between system partners. We've hit on that a little bit today too. And restrictive eligibility criteria. And then lastly, the lack of consistent data collection, documentation, and continuous quality improvement and performance monitoring. And we are in the process of working with the Wraparound Evaluation Research Team, which is based out of the University of Washington, to establish a contract with them so that we can address that whole issue at the very bottom. Okay, all right, so let's take a look here at, well, do we want to get into this or move right on to the resources?
Yeah, I can jump in here.
Do you want to? Okay.
Yeah, I mean, we're not going to go too deep into this. Most of what you need to know is that there was funding allocated to child welfare, probation specifically, and behavioral health for implementation of aftercare. So there is new money out there for aftercare wraparound. I'm not going to go through the nuances of it, but if you look at these letters, if you pull it up on your phone, you can look up your county's allocation amounts and how to have access to those funds.
All right, so let's take a look at some of the resources that are available to you right now. And if you download the digital copy, the link is right there for you. You can see at CDSS Wraparound website, and the email is there, giving you some FFPSA guidance and resources. Of course, UC Davis Resource Center for Family-Focused Practice is a great resource as well. There's the email us, that comes right to our unit, the wraparound questions at dss.ca.gov. And of course, Daniel put his own email up there for you to just reach out to Daniel.
You can email Chris, too.
All right, let's look at what else do we have for you. So besides having a wraparound website that you can access and learn more, and there's training links, all of that, you can now access, well, now since back in October, actually, the fall, the CDSS FFPSA website. Again, you can see the link is there for you. And there, one of the things that I would highly recommend, and I can't remember who I was talking to. There you are. Yeah. That's the email that we were talking about yesterday. Yeah. So if you have specific questions around that, I would encourage you to use that email. There's also, I think it's on this website as well, is how many of you have gone to the first Tuesday of the month? That around 3:30, there's a Q&A. Was that helpful for you?
Yes.
Okay. So if you haven't accessed that, it's the first Tuesday of the month. It's at 3:30 to about 5, and they field common questions regarding FFPSA Part 4 specifically. And then there's also an opportunity for you to ask your questions via chat, that sort of thing. So if you haven't had enough Zoom webinars, hey, join us for that. But in order to do that, you want to reach out on that website and sign up for that webinar on the first Tuesday of every month. So I would highly recommend that. All right, so I mentioned earlier, just a few minutes ago, the Resource Center for Family-Focused Practice website. And who's going to the PWBI, the Partnership for Wellbeing Institute? Okay, we got a couple folks that have signed up for that. All right.
June 15th through 17th in Anaheim, down the street from Disney World.
So there's still time to sign up, but here is a resource that is available. You can register for trainings, meetings, especially around wraparound. I would recommend that as well. Okay, and then let's spend a little bit of time here in the wraparound toolkit. So there's a lot of, this is in development. We're still in development of this, right?
It's linked from the webpage, so it's live
Okay,
now.
so it is live now? Okay, great. So the toolkit is actually live for you, where there's resources, trainings, and one of the things that I really appreciate about this is you can see there are, like under the first one, there it says why a toolkit. So you can click on that, drop down with a bunch of resources there for you. And how did the toolkit develop? All of this came to be through work groups. There was the Fidelity and Data Outcomes work group. There's the Workforce Development work group, and then the Leadership and Organizational Practice.
Fiscal and organizational leadership.
I almost said it. Okay, so those work groups were county folks, they were providers, state folks. We came together, and I think, Rachel, you were sat in on a few of the Fidelity and Outcomes data work group and pulling this together. So here is the wraparound toolkit. There is who was involved. Again, please feel free to start looking at that as far as resources as you start to think about how to get started and get better.
And a couple just that I wanted to specifically highlight while I have my voice working. The implementation toolkit by the National Wraparound Initiative, and there's a whole guide for youth who are placed in different counties to for that transition from the county of jurisdiction to the county of placement for wraparound services to help with that continuity of care. That can be a real challenge and struggle we've heard from many counties when youth are placed out of counties. How do we ensure that they keep receiving wraparound in the home with their grandmother or one of the RFA homes in the receiving county? And so there's a toolkit or some guidance in there that really guides how to do that at a practice level, but especially a programmatic level of like, how do you make the funding work and how do you have those somewhat political conversations with other counties? There's a lot of resources in there to support all of that. And then anything else that, if anybody's tooled around in there yet or anything else that anyone wants to highlight, feel free. But it's a lot of really great information to support implementation. And again, the certification requirements and the county approval requirements, like the report templates, we're developing those with the work groups that Chris mentioned. And that should be out in October. And like I said, counties and providers will have about a year to get all their the documentation pulled together and written and internal changes made and plans made to get those submitted. And the way that we're structuring it is really going through each wraparound standard and instead of having you write like a whole report that we'll look at once and you probably will never look at again, we're looking at having a document where you submit your current documentation, whether it's the county wraparound coordinators or a provider, of contracts, of policies and procedures, or any other organizational documentation, and just basically note on what page of that organizational documentation that standard is integrated, and then we review all of that to certify and approve and provide technical assistance. We're really working hard to try and reduce the administrative burden of the aftercare requirements that counties and providers will have to do, especially just submitting a report that, like I said, folks don't usually read regularly. And if there's a situation, where a county or a provider doesn't have a policy and procedure document around wraparound, instead of spending your precious resources writing a report, spend your time writing the policy and procedure document so staff, that will be available to staff and partner organizations. So that's what we're looking at. It's not fully fleshed out yet, but again, if you look at the toolkit, if you look at the California wraparound standards, you can start looking at that now to guide your own individual practice and your organization's administrative structures around what you may need to do to bring your practice or organization into alignment with that. Any questions so far, or any other thoughts?
I was just going to add, too, that regarding those work groups, if you want to be involved and want to participate, they're not closed. So if you reached out to our wraparound email and send out, hey, I'm interested in, like I mentioned, there's 3. There's the Fidelity and Outcomes Work Group, which is mostly about CQI, all right, continuous quality improvement. There's the Workforce Development Work Group, and then there's Fiscal and Organizational Leadership Work Group. So if you're interested in participating in any of those 3 work groups, please reach out to us, and that way you can stay in the know and you can actually have a voice in the work that we're right in the middle of doing right now. So feel free to email us with that. All right.
Is RapStats going to be the data collection point, or
I'll try to explain that as long as my voice works. So with RapStat is the database to collect fidelity tool data. And it's a little bit of a long story. We wanted to use it, but there's a federal requirement basically saying that child welfare information systems, there can't be auxiliary systems to the child welfare information system in states, or else we risk losing federal funding. So the intention at this point is to build the functionality of RapStat into the child welfare information, into CWS Cares, the new project. And we have to do that for FFPSA Part 1 interventions anyway. So it really makes sense to roll everything in together. And, we don't want to lose millions of dollars in federal funding because that would be bad. So that's kind of the direction we're taking right now. But that's unfortunately still a couple of years off. So we'll have some interim solutions and leeway and guidance and grace, for the CQI evaluation components of aftercare, that we won't really be able to fully support that, but we'll have this contract that Chris mentioned with the wraparound evaluation and research team available to help support counties and providers in their development of continuous quality improvement processes for their wraparound programs.
Hey, real quick, can you circle back to you don't have to have an open case for that 6-month period of aftercare? It's kind of counterintuitive to be going into a home that we don't own when things can go sideways in there.
Yeah, I think that's a great question. We've heard from a lot of probation agencies that when the youth exits the STRTP, we close the case, or the placement order is rescinded, and so we close the case. So how do we provide aftercare if a youth has exited and we've closed the case? So definitely, we encourage, aftercare follow-up if it makes sense for probation to stay involved formally to do that. But if you have a practice in your probation, we didn't want to upend probation practice with this. So if there's a practice of closing the case when the youth exits the STRTP, you can still have a community-based provider come in and provide wraparound services, even if the case is closed. We just don't want to put a box on that, so out of curiosity, how many probation agencies you close the case in CWS CMS when the youth exits the STRTP? Yeah, so most of you do, and we didn't want to force your hand to have to do that because that would have been a really large unanticipated administrative expense. But if you currently do that, absolutely you can do a probation case concurrently with wraparound. And the funding actually funds, that's been allocated funds a month of wraparound while the youth is still in the STRTP to support that transition and to begin building those relationships, and then 6 months of aftercare thereafter. But whether a probation case is open or not is left up to the local jurisdiction based on their respective practices. You just have to offer aftercare wraparound service, or right now aftercare services, and come October 2023 it has to be wraparound services. So I hope that answers your question a bit. It really depends on the county. If you're a county that keeps the probation case open after the youth exits STRTP, do that and offer wraparound. If you close the case, you can do that and still offer wraparound to the family.
Yeah, our specific question was, what happens if a youth's probation is terminated at the conclusion of the placement? And Daniel was able to explain to us that is not prohibitive to the service. Since we as probation departments do not provide wraparound directly, it does not mean that the client cannot still get it. So I understand that the request is not for the probation officer to continue to manage the case collaboratively with the service provider. If the youth has earned a termination of probation, that case will continue on through the provider. It doesn't have anything to do with the probation department. It's simply a referral to them prior to the youth being terminated.
And Daniel, is the funding for that going to be available for all wraparound providers?
It's available for youth who would be, the eligibility criteria, so to speak, would be for youth exiting an STRTP to a family-based setting. And so the county would have a contract with a provider to offer that. And then that would be included in the terms of the contract of getting paid after the case is closed.
Perfect, thank you.
Yeah, so the funding is, there's an allocation through CDSS to child welfare and probation, and there's an allocation to behavioral health. So, I mean, if the youth is still eligible for Medi-Cal after they exit, they would be able to access those funds through Medi-Cal. Otherwise, it would be the child welfare probation allocation through CDSS. Yeah, when we constructed the county fiscal letters, we didn't put that as a limiting criteria that there needs to be an open case in order to fund your provider to provide those services.
I think the understanding that our providers have within our county is wraparound requires a placement agency. And so similar to what's been said is after there is no probation or Department of Children and Family Services, they automatically close that.
Mm-hmm. So.
How do you refer them back to an IN or an ACL that says otherwise?
Yeah, so the question was, what if our county requires there to be some sort of dependency involvement, delinquency, like that there's an adjudication in order to, or a placement order in order to provide wraparound? That would be something for the county administration and the county interagency leadership team to identify those county policies that are in conflict with the state policy and just and resolve those so it's built so everything's in alignment. Oh, yeah.
Sorry, more funding questions. So, if RAP continues after probation terminates, we use Seneca, so we say Seneca. Who is Seneca billing?
So, I mean, you would use the same typical contracting mechanisms that you would use, that Seneca would use in general, like however they claim or bill to child welfare or probation for their wraparound services. It should be that same mechanism, but that differs from county to county.
How do you bridge the gap in aftercare services when you have a youth or resource staffing for them, and then from one moment to another, an opening comes up, and then there's that gap in aftercare services for the youth. Any suggestions, recommendations from other departments that are dealing with a similar situation?
Yeah, so is the question about the referral and coordinate to get this wraparound services started, or placement finding, or both? So for the referral to wraparound and kind of coordination around that, in the toolkit that we talked about, there's a lot of supporting documents to help guide the administrative level conversations between two counties where the youth is moving from one county to another. We can't dictate what that looks like at the state level because every county's accounting and fiscal processes look so different. There's just no way to get all 58 counties on the same page with that, but there's a lot of great guidance documents in there to help have those conversations. Regarding finding placement, I mean, there's a lot of services throughout the state to help support that. RFA programs, working with your local or with your county's RFA program, with FFA providers. We also have a service called Daily Solutions. It's micro-targeted resource parent recruitment. Has anyone in here used the Daily Solutions contract with us? A few of you?
I think maybe not through you, but through AFS potentially.
With what?
Through AFS potentially. I believe
yes.
they utilize it and we utilize AFS, so yes.
So basically that's using social media and all those fancy algorithms that they have and all the data they have about all of us to use to target campaigns for either population-specific youth who are hard to place or specific individual youth, removing all identifying information, of course. And it's been pretty successful. I mean, those of you who have used that, you can feel free to chime in and share that. You can contact us if you want to use that service. It's free. We pay for it at CDSS. And again, it's really using social media to target folks who, there's a lot of data about demographic information and interests that people put in their profiles that may be a good fit based on the needs and the strengths and personality of specific foster youth, and they use a lot of that data. So for those of you who have used that, feel free to share your experience.
Is there going to be a modality established for THP clients that don't have a family where RAP wouldn't be an option in those cases for the clients that are going to live in independent living, THP facilities, not family cells?
Yeah, the question was, can the funding be used to fund aftercare services for youth stepping down to THP SILPs? And yes, that's included in the funding. So if the youth is stepping from STRTP to a SILP or a THP, the aftercare funding can be used to fund aftercare wraparound for those youth too.
And I think that, Anna, correct me if I'm wrong, that we're out of time. To the Daily Solutions, our county recently signed up, and we had a big goose egg every time we tried to do a recruitment, but within just a few months of working with them, we've had 70 leads just from the targeted marketing. So that's a little bit about our experience so far, and we're excited to see where those 70 leads will take us.
Well, thank you all for...
The closing remarks also in these rooms, so they're going to like remove the walls, and so you guys can remain, get up and stretch out, but remain after the session. Daniel, I'm sorry.
Oh, no worries. I just want to say thank you all for being here. Apologies for my voice. And if you want to get anyone's email addresses or have side conversations, feel free to come on up. Thank you all.